Hi, how are you?
Good, how are you?
Good. I'm going to be assessing you today. My name is Jacob.
Okay.
Just going to wash my hands over here.
Okay.
Okay. So how are you?
I'm good. How are you doing?
I'm really good. I'm just going to assess your chest here, and I'm just going to assess your breathing and everything that brought you in here today, okay?
Okay.
So I'm going to just be looking at your lips and your skin. And your rate. Okay. The patient's respirations are even and unlabored when you have a regular rate and rhythm of breathing. There's no use of accessory muscles, nasal flaring, or sternal retractions that I can see.
That's good.
Your thorax looks symmetrical, and there's no visual deformities. And I also can see that your spine is midline and doesn't look like any spinal abnormalities. Okay.
Okay.
Okay. Gonna feel your chest and just listen and see if I find any abnormalities. Please let me know if you feel any tenderness, okay?
Okay.
Sorry if my hands are cold. It's
No.
2 degrees outside.
No, it's okay.
Okay. Okay. I'm just gonna feel on the side here. Okay. So upon palpation of your thorax is not tender, and there was no notice of masses or crepitus that I saw. And tactile phrenitis is symmetrical bilaterally.
Okay.
Okay.
That's good.
And I'm going to check that by having you go ahead and say 99.
99.
And do it one more time.
99.
Okay. And then I have here.
99.
Great. Okay. I'm going to keep, now I'm going to percuss. So I'm going to just basically take my finger and you're just going to feel some tapping going on. Okay. So. Okay, great.
Perfect.
Percussion reveals resonance through the anterior and lateral lung fields that we assessed, indicating that you have normal lung inflation. Okay? Now I'm going to take my stethoscope, which might also be cold.
It's okay.
And I'm going to listen, okay? I have to listen to 16 spots, so.
That's okay, as long as my heart's beating normally.
Okay. Great.
Good. That's
Your
good.
lungs sounded really good.
Good.
Basically, after auscultating 16 different sites, anterior and laterally, it reveals that you have clear and equal breath sounds bilaterally, and I didn't hear any adventitious sounds like wheezing, crackles, or ronchi. Now I'm just gonna basically go towards your back, and I'm gonna feel and assess it, and we'll go from there. Okay, basically what we just did, but on your back. Hi, your dog is in the assessment.
My dog is in the assessment. Okay.
So basically what I'm going to do now is I'm going to inspect your back. Okay. Great. I'm going to now go ahead and palpate and feel for any tenderness. Please let me know if you have any tenderness.
No.
No? Okay, great. Posteriorly, expansion is equal bilaterally. There was no tactile phrenitis, which I assessed a little bit earlier, and there's no tenderness on your posterior side. Okay, now I'm just going to go ahead and percuss like we did before, the little tappings, and just see what your lung fields feel like, okay, and if there's any densities. Okay. Your lung fields that I percussed over are remain resonant and with diaphragmatic excursion measurement approximately about 4 centimeters bilaterally. You have no diminished areas and there's no areas of absent breath sounds. No abnormal breath sounds were noted either, okay?
Mm-hmm.
Okay. Breath sounds are clear bilaterally with no diminished or absent areas. No abnormal breath sounds were noted, okay?
Mm-hmm.
I'm just going to do a couple other tests that we have, and I'm just going to basically go ahead and have you basically say, I'm going to be feeling your back, and I'm going to ask you to say a couple of words. This is going to be the whispered pectililoquy test.
Okay.
I'm going to have you say 1, 2, 3, real whispered, though. Okay. Okay, your spoken words are faint and indistinct. Now I'm going to go have you say 99 again.
99.
Okay.
99. 99.
Great, and that's the bronchophony exam, which was also negative. For egophony, and basically I'm going to have you say assessment.
Assessment.
Okay, and I didn't hear an E to an A sound, okay?
Mm-hmm.
Great. Cardiac assessment now, okay? Basically what I'm going to do is I'm just going to inspect your chest, and we're going to go from there, okay?
Sounds good.
So I'm basically just going to feel here. I'm going to feel at your fifth intercostal midclavicular space, so it's going to be kind of over your breast area, just letting you know. And I'm just going to feel for your apical impulse. Okay, great. I'm going to feel your carotid arteries one at a time. Might feel like almost choking a little. Okay, great. I didn't notice any tenderness. Did you feel any tenderness? Great. Okay, so what I took from that assessment was that there's no visible pulsations, heaves or lifts are noted on your precordium. The apical impulse is visible in the left midclavicular line of the fifth intercostal space. Jugular venous pressure, I noticed that you have a carotid artery +2 pulse, which is normal. Okay?
Mm-hmm.
It's not bounding, just a normal pulse, okay? Bilaterally. Okay? Now I'm going to I palpated and inspected, I guess. So I also noticed that your carotid pulses are strong, regular, and equal bilaterally. There was no thrills noted, which I'm going to auscultate now. There's no thrills noted. The pulse of maximal impulse was, as I said, the midclavicular line of intercostal space. It is not tender and is not displaced, which would indicate hypertrophy, okay? No heaves, thrills, or thrills were noted upon palpation. And now I'm going to do the percussion that we did before. Okay? Percussion of the lateral heart border confirms normal cardiac size, pulse of maximal impulse, and remains within the normal anatomical limits, okay? So your heart's looking good so far. And now, listen to your heart, okay? Mm-hmm. I'm going to listen to your carotid arteries up here, and then we'll start listening around lower, okay? Mm-hmm. Okay, I'm going to start up here. Oh, okay. Okay, now I'm going to listen to your heart. I'm going to listen at your apical pulse. Okay. And I'm going to listen at your aortic, mitral, tricuspid, and your pulmonic areas. Okay. And now I'm going to do it with the bow. Okay. Wow, I really hear your heart loud.
That's good.
Okay. Your carotid arteries are auscultated with no bruits or thrills that I detected. Your heart sounds were auscultated at the aortic, pulmonic, tricuspid, and mitral area using both the diaphragm and the bell. The heart rate was regular and distinct 1 and S2 sounds were present. There were no murmurs that were S3 or S4s, splitting rubs, or any type of other abnormalities noted.
Perfect.
Okay, now I'm just going to be your pulses, and I'm going to look for your extremities, and that will be the end of our assessment.
Okay.
Okay, so can I see your hands, please?
Mm-hmm.
I'm just going to see that what I see is your skin is warm and intact with no discolorations. Sorry.
No, you're fine.
With no discolorations. Great. There's no ulcers or varicosities that I see on your legs. No clubbing or cyanosis is noted. I'm going to go ahead and assess your capillary refill. Since you have nails, I'm going to flip it over to this side. And we're going to note. Great. And we're going to do this in all of your fingers, okay?
Mm-hmm.
And that's coming back less than 3 seconds. Good. Good. And we'll imagine doing it with the toes.
Okay.
And I see that they're all within 3 seconds, okay?
Mm-hmm.
I'm going to go ahead and feel your pulses now. Great. You have great radial pulses. And I'm going to feel for your posterior tibial pulses. Great. And your dorsal pedis pulses. Oops, sorry, honey. Okay, great. All your pulses that I felt were strong and are equal bilaterally, and I've graded them with a +2 in the radial and also in the other ones that I mentioned. I think I have to feel for your popliteals too. Popliteal, which is normal, and your brachial. Great. And I noticed that those are all +2. Your brachials were +3. Good, strong.
Good.
Good, strong. And we're normal. I also noticed that there was no edema or any signs of any tenderness on your extremities.
Okay.
And no atrophy. Can I just do one last test? I'm going to do a skin turgor test, and I'm just going to assess for hydration. Great, and your skin went back, and you have good skin turgor. So thank you so much for your assessment today.